Good day everyone, especially to you Mr. Gamale. I am Dexter B. Ronoco, BS Criminology 3rd Year College. I will discussing about forensic chemistry and toxology, chapter 6, drugs, and chapter 7. So, define drugs. A drug is any chemical substance that causes a changes in organism physiology and psychology. When consumed, drugs are typically distinguished from the food and substance that provide nutritional support. Medical drugs, a substance which, taken into a human body, cures illness and or relieves signs symptoms of disease. Dangerous drug, a substance affecting the central nervous system which, taking into the human body, brings about physical, emotional, or behavioral changes in a person's taking it. Drug abuse, any non-medical use of drugs that cause physical or psychological, legal, economic, or social damage to the user, to people affected by the user's behavior. Abuse usually refer to illegal drugs, but may also be applicable to drugs that available legally, such as prescribed medication and certain over-the-counter medication. Classification of drugs. According to origin, natural drugs are active ingredients, secondary metabolic products of plants and other living systems that may be isolated by the extraction. Examples: raw opium. Opium narcotic drug that is obtained from the unripe seed pods of the opium. This raw opium may be ground into a powder, sold as lumps, cakes, or bricks, or treated further to obtain derivatives such as morphine, codeine, and heroin. Marijuana. Cannabis, also known as marijuana. Among the other names, it is a psychoactive drug from cannabis plant native to Central Asia, the Indian subcontinent. The cannabis plant has been used as a drug for both recreational and entheogenic purposes, and it various traditional medicines for centuries. Coca bush. Medicine. Traditional medical uses of coca are foremost as a stimulant to overcome hunger and thirst or thirsty. It is considered particularly effective against altitude sickness. It also used as an anesthetic and analgesic to alleviate the pain of headache, rheumatism, and wounds and sores. Synthetic drugs are artificially produced substances synthesized in the laboratory for illicit market, which almost wholly manufactured from chemical compounds in illicit laboratory. Examples: methamphetamine. Methamphetamine is a potent central nervous system stimulant that is mainly used as a recreational drug and less commonly as a second-line treatment. For attention deficit hyperactivity disorder and obesity. And next one is barbiturates. A barbiturate is a drug that acts as central nervous system depressant. Barbiturates are effective as anxiolytics, hypnotics, and anticonvulsants, but have physical and psychological addiction potential as well as overdose potential, among other possible adverse effects. According to legal classification, RA 9156 Comprehensive Dangerous Act of 2002, volatile substances, RA 6425 classified as regulated and prohibited under RA 9165, otherwise known as the Comprehensive Dangerous Drug Act of 2002. The term prohibited and regulated was changed into dangerous drug with the following classification: immediate precursor, a chemical substance used in the clandestine manufacturing process, become incorporated into full or in part into final molecules. A substance under international control. And next one is essential chemical. Chemical substance used as reagent or resolvent in illegal manufacture of controlled substance. According to international classification, narcotic substance used to treat moderate to severe pain. Narcotics are like opiates such as morphine and codeine, but are not made from opium. They bind to opioid receptors in central nervous system. Next one is psychotropic substance. A drug or other substance that affect how the brain works and uses, causes change in mood, awareness, thoughts, feeling, or behavior. Are example of psychotropic substance include alcohol, caffeine, nicotine, marijuana, and certain pain medicine. Next one is designer drugs. Methamphetamine are some example of designer drugs. These drugs also be referred as the club drugs because of their use in nightclubs. According to pharmacological classification effect, stimulants are drugs which increase alertness of physical disposition. Example, amphetamine is a central nervous system stimulant that is used in the treatment of attention deficit hyperactivity disorder, narcolepsy, and obesity. Amphetamine was discovered in 1887 and exists as two enantiomers in enantiomers, levamphetamine and dextroamphetamine. And next one is hallucinogen. Hallucinogen are drugs which affect sensation, thinking, awareness, and emotion. Example are ecstasy, methylene dioxymethamphetamine are commonly known as ecstasy, or Molly is a psychoactive drug that primarily used for recreational purposes. The desired effect include altered sensations, increased energy, empathy, as well as pleasure when taken by mouth. Effect begin in 30 to 45 minutes and last up to 3 hours to 6 hours. Next one is depressant. Are drug which depress or lower the function of the central nervous system. Example are barbiturates, alcohol. Mixing alcohol and barbiturates can be deadly. Both of these drugs slow down your nervous system, so if you take them together, your heart and lungs may slow down to the point that they stop functioning. If you can't stop thinking, stop drinking. While or barbiturates, you may addicted to one of both drugs. Next one is inhalants. These are any liquid, solid, or mixed substance that has the proper or releasing toxic vapors of fumes. Example are solvent, glue, gasoline, kerosene, paint, thinner, and naphthalene. So, under the Republic Act 6425, otherwise known as the Dangerous Drug Act of 1972, dangerous drugs are classified three main categories. And number one is prohibited drugs. Prohibited drugs, which include opium and its active components and derivatives such as heroin, morphine, and coca leaf, and it is derivatives principally cocaine, alpha and beta. Hallucinogenic drugs such as mescaline, lysergic acid, diethylamide, and other substances producing similar effect. Prohibited drugs. The penalty of imprisonment ranging from 14 years and 1 day to life imprisonment, and fine ranging from 14,000 to 30,000 shall be imposed upon any person who, unless authorized by law, shall import or bring into the Philippines in any prohibited drugs. And the next one is regulated drugs. Drug regulation is the control of drug use by the international agreement and or by regulatory authorities, such as the U.S. Food and Drug Administration, FDA, and the European Medicines Agency, EMA, and the Japanese Pharmaceutical and Medical Devices Agency, PMDA. This includes regulations concerned with the development, approval, manufacturing, and marketing. Marketing of drugs. Regulated drugs are for this, the penalty of imprisonment ranging for 6 years and 1 day to 12 years, and fine ranging from 6,000 to 12,000 pesos shall be imposed upon any person who, unless authorized by law, shall import or bring any regulated drug into the Philippines. And the third one is volatile substance. The term volatile substance refers to gases or chemical that evaporate at room temperature to form a vapor which can be inhaled. They are found in a whole range of legal household products, liquid, solid, or mixed substance, having the property of releasing toxic vapors, of fumes, or any chemical substance which sniff, smelled, inhaled, or introduced into physiological system. The body produces, induce, and condition of toxication. Drug dependence. Drug dependence occurs when you need one or more drugs to function. The American Psychiatric Association, or the APA, used to distinguish between dependence and abuse. Abuse was considered the mild or early phase inappropriate drug use that lead to dependence. People view dependence as more severe problem than abuse. The EPA replaced dependence and abuse with substance user disorder in the 2013. The Diagnostic and Statistical Manual of Mental Disorder. This diagnosis focuses on the disorder involving the use of substance. Characteristic of drug dependency. Now, there are three characteristics of drug dependency. Number one, physical dependence. The body physical system changes until the body needs that particular drug in order to function. Number two is mental or psychological dependence. This need of drug in order to feel good, to get by or feel normal. And the last one is idiosyncrasy or side effect. Idiosyncratic drug reaction may be defined as adverse effect that cannot be explained by known mechanism of action of the operating agent, do not occur at any dose in most patients, and develop mostly in unpredictable in suspectable individuals only. Chapter 7. Examination of dangerous drugs. Drugs identification. It is a branch of forensic chemistry that deals with the scientific examination of drugs and volatile substances. These types of sample taken from the body for drug identification as directed by the condition of the body and the most likely place for drug to congregate. If the person is alive, when the blood, urine, and increasingly hair are preferred samples. If the person is dead, then all of above may be available. Drug identification is usually conducted by forensic chemical officer to determine the presence of dangerous drug on submitted specimen. The forensic chemist or chemical officer also conducted drug tests on body fluids of suspected drug pusher and user to determine the presence of dangerous drug metabolites. Paraphernalia like smoking pipes, toothbrushes, and to determine the presence of dangerous drug. Forms of dangerous drugs. Drugs are in various forms. This includes tablets, capsule, liquid, powder, brick or decks from marijuana, crushed leaves, and uprooted plants. Examination on the sample taken from the alleged confiscated dangerous drug. Methods of examination. Qualitative examination and quantitative examination. Step common to qualitative and quantitative method. There are 8 step common qualitative and quantitative methods. Number 1 is selecting of method to be used. Number 2, physical test. Number 3, sampling. Number 4, sample preparation. Number 5, chemical test. And number 6, confirmatory examination. And number 7, calculation and interpretation of dates. And last one, number 8, drawing of conclusion and writing reports. There are 2 phases in examination of the alleged confiscated dangerous drug. Number 1 is screening test. Preliminary test, also known as color test. This test is non-specific, preliminary in nature. It is employed to reduce the family or group of drugs to a small and manageable number. Screening test. It includes series of color tests producing characteristic color from each family or group of drugs. This is done by the adding specific reagent to unknown sample in a spot plate screening. This is quite simple to perform even in narcotics investigation courses. Test reagents and basic apparatus are commonly available. Number 2, confirmatory test is the method employed to confirm the result of screening. Preliminary test involves the application of an analytical procedure to identify the presence of specific drugs or metabolites. This is independent of screening tests and which uses techniques and a chemical principle different from that of initial tests in order to ensure reliability and accuracy. Number 3, chromatography is the process of separating the mixture, comparing the migration of each component with standard. Some chromatography techniques include gas chromatography, thin layer chromatography, high pressure liquid chromatography. So, what is gas chromatography? It is a separate technique. The mobile phase is gas. Separation is based on the difference in migration rates among sample components. Spectroscopy, a confirmatory method whereby light is used to identify the sample specimen. Number 4, Fourier transform infrared spectroscopy is used to quickly identify compounds such as plastic, blends, filter, paints, rubber, coatings, resins, and adhesives. It is applied across all pieces of the product. Life cycle including design, manufacture, and failure analysis. Ultraviolet visible spectroscopy refers to absorption spectroscopy or reflectance spectroscopy in part of ultraviolet and the full adjacent visible regions of the electromagnetic spectrum. This means it uses light in visible and adjacent ranges. Examination of the urine specimen is a type of pure urine. A urine analysis is used to detect and manage wide range of disorder such as urinary tract infections, kidney disease, and diabetes. A urine analysis involves checking the presence, concentration, and content of urine. Abnormal analysis result may point to a disease or illness. Validity test for urine specimen. An initial validity test is the examination utilized to screen urine sample for sign of adulteration, substitution, or dilution. Adulteration is the addition of chemical substance such as ammonia or vinegar to a urine specimen after has been collected. Reason for conducting validity tests in cases of unobserved urine specimen. When there is suspicion that urine specimen has been tampered. Instances when the following unobserved urine specimen collection. Number 1 is when donor is typically unable to go to the laboratory. And number 2, when the donor is involved in crime scene. Number 3, when donor is involved in post-accident trauma. And number 4, when donor is critically ill. Different types of tempered urine specimen. First one is adulterate. An adulterate is a substance found within a substances such as food, cosmetics, fuel, or other chemical that compromises the safety or effectiveness of said substance. Second is diluted. Refers to a specimen with less than normal physiological constituents. And the third one is substituted. A specimen has been derived through switching or replacement of the original sample. Ways to substitute urine sample. Addition of salt, addition of juice, addition of detergent, addition of bleach, and other oxidizing adulterants. And last is addition of illicit drugs. Ways to substitute the urine sample. Urine from the friends or other person not using drugs may be used as substitute specimen. Replace sample with other substance similar to urine appearance. Two ways to adulterate the urine specimen. Internal dilution. Internal dilution occurs within mining block in which packets of waste are enabled to be separated and are mined with the block. Degrees of internal dilution can vary within various types of disposition. Specifically, lithological and grade distribution significantly influence the degrees of dilution. Number 2. External dilution. External dilution is the waste of outside of the body that is mined within the block. It varies based on assortment of parameters and can be controlled using effective equipment using mining practices. The following initial can be used to minimize external dilution, defining the contact surface of ore and waste. There are 6 parameters for validity test. Number 1 is the physical characteristics such as color, odor, and etc. Number 2, volume. Number 3, temperature. 4, pH. Number 5 is specific gravity. And number 6, nitrates. Confirmatory validity test. In confirmatory validity test, there are 8 confirmatory validity tests. Number 1 is physical characteristics such as color, odor, or etc., volume, temperature, pH, specific gravity, nitrates, creatinine, and oxidizing agents. Other method of confirmatory test physical characteristic visually determine. Number 2, volume same as physical characteristics. Number 3, temperature using thermometer. Number 4, pH meter calibrated with approachable buffers. Number 5, specific gravity use refractometer. When do, when do we consider a urine specimen is invalid? A urine specimen considered invalid under the following circumstances. Number 1, adulterated substitute or diluted. Number 2, improperly collected, handled, and stored. And number 3, improperly documented. So that's all for today.